Hi, I'm Dr. Gaile Robredo-Vitas, and for today's video, I'm going to talk about how to take care of your skin while you're pregnant. The skin changes that pregnant women experience include acne or pimple marks and pigmentation or discoloration, and this is due to the increase in androgens in your body when you get pregnant. When I was having my daughter, I experienced acne and papules and pustules along my hairline, and my underarms even darkened. And of course, I wanted to do something about it. Gusto ko silang tanggalin. But then of course, I was worried that what if I use something or I take something and it harms my baby? So the question that we want to answer is, how do you take care of your skin without harming the precious little one inside of you? When it comes to topical skincare products, lucky for us, our skin is brilliantly designed to serve as a barrier protection to effectively keep things out, including substances that we put on it. This is due to the top layer of our epidermis called the stratum corneum, which is made up of flattened cells surrounded by lipid-rich fatty material such that it looks like a brick wall. Beneath our stratum corneum is a part of the epidermis with very little vascularity compared to the dermis below. This combination of a very efficient skin barrier protection plus lack of vascularity ensures that penetration of anything we put on our skin is not that easy. In general, most of the skincare products that we use in our daily lives, such as our facial cleansers or our moisturizers, are formulated not to be systemically absorbed. Hindi sila makakarating sa bloodstream mo and they will not reach our babies. In those women who are fortunate enough to have no problems when they're pregnant, super swerte nyo, my bare minimum requirements or recommendations to keep your skin looking young and healthy are the following. Number 1, a good soap-free mild cleanser that effectively removes all the dirt and grime in your face without compromising your barrier protection. Number 2, a moisturizer with any of your favorite ingredients that are safe for pregnant women. It can be your exfoliants, your alpha-hydroxy acids, or even your vitamin C. And finally, of course, your sunscreen, which is a very important part of your skincare routine that you should not forget, because pregnant women experience a lot of pigmentation problems. However, in some patients who are experiencing pregnancy-related skin conditions that I mentioned earlier, there are things that are safe to use, while there are others that you must absolutely avoid at all costs. Let me start with ingredients that you should steer clear of. Number 1 is hydroquinone. Hydroquinone is widely used around the world and is the gold standard lightening ingredient. It's very effective in addressing pigmentation issues. However, hydroquinone fully penetrates the skin barrier and enters our bloodstream with measurements ranging from 35% to 45% immediately after topical application. There are no studies that prove that it actually reaches your placenta. However, the size of the molecule is small enough to do so. Number 2, we have your retinoids. So retinoids are derivatives of vitamin A, and they come in oral and topical form, and they are prescribed to treat acne. Retinoids include your tretinoin, your retinol, your retinaldehyde, your tazarotene, and your adapalene. Oral retinoids are proven to cause birth defects, which include problems sa heart, problems sa nervous system, and therefore should absolutely be avoided when you're pregnant. When it comes naman to topical retinoids, merong conflicting information. So some studies say that they are safe, some studies say that they have caused birth defects. So in my opinion, until more research is done and larger scale studies are done, I would recommend that you don't use topical retinoids when you're pregnant. Third would be your oral tetracyclines, which are antibiotics used in the treatment of acne. They include doxycycline, your minocycline, and they are not recommended to be used while pregnant kasi they can inhibit bone growth in your unborn child. Now we move on to the more positive side of this video, to ingredients that are safe to use. First up, we have sunscreen. Sunscreen use is recommended period, whether you're pregnant or not. I always advise my patients to go for physical sunscreens, your zinc oxide, your titanium dioxide, because they physically block the UV rays from entering your skin. That is not to say that chemical sunscreens are bad. They are also safe for pregnant women. What's important to remember is that, especially when you're outdoors, is to reapply every 2 to 3 hours to keep your skin protected. Next is azelaic acid. Ginagamit siya to treat rosacea, as a lightening ingredient, and even acne. It works by killing bacteria found in pores and decreases the body's production of keratin. Third ingredient is benzoyl peroxide, which is another treatment for acne. It's an antibacterial and also prevents formation of comedones, or your blackheads and whiteheads. There are no published data regarding the safety of benzoyl peroxide in pregnant women, but since absorption is very minimal, current evidence suggests that it is safe in pregnant women. Fourth ingredient would be your salicylic acid. Now, salicylic acid is a very popular ingredient that you can find in your cosmetic products and is also used to treat acne. Again, no studies have been conducted in pregnant women. However, since only a relatively small proportion of the product gets absorbed in the skin, it is highly unlikely to pose any danger to the developing baby. Fifth, we have glycolic acid, which is an alpha hydroxy acid. Again, another very popular cosmetic ingredient which is also used to treat pigmentation and acne. Using topical glycolic acid during pregnancy is deemed safe because only very minimal amounts are absorbed systemically. And then finally, we have your topical antibiotics, your topical clindamycin, and your topical erythromycin. They are usually used in combination with other topical creams and may be prescribed in pregnant women with severe acne breakouts. However, because these are considered prescription drugs or medicines, short-term usage in pregnancy is recommended. Now we go to procedures. In general, I advise my patients to postpone their non-essential or cosmetic treatments till after they give birth. However, if there are certain pressing conditions that you feel should be addressed or should undergo treatment, meron namang mga procedures that are safe to do that will not harm our babies. Minor surgical procedures such as your shave excision, your punch biopsies, or your scissors excision are deemed safe during pregnancy. I think the concern is more of in the usage of the anesthesia pag ginagawa yung mga procedures na to. The most common anesthesia that I use topically on my patients is a combination of lidocaine and prilocaine, and both of them are considered safe to use in pregnant women. Injectable lidocaine is actually pretty safe because your fetuses can metabolize them in case they cross the placenta. One major concern lang is that if large amounts are inadvertently injected into your blood vessel and it crosses the placenta, it may cause cardiac or nervous system toxicity to your fetus. But in dermatology, we don't really inject that much lidocaine before we do a procedure. Another famous procedure that pregnant moms out there want to do or would like to experience are chemical peels. Glycolic and lactic acid peels are great in the treatment of acne and pigmentation. They are generally considered safe because they have negligible dermal penetration. Then we have your salicylic acid peels. They are also very effective in treating acne and can be used in pigmentation as well. If you want to use salicylic acid because you have a lot of acne lesions, just make sure that the area of coverage is limited. What about TCA, or your trichloroacetic acid? So trichloroacetic acid is not recommended for use in pregnant women for cosmetic purposes because in some studies it has been associated with incidences of low infant birth weight, which later on can lead to fetal growth retardation. However, in pregnant women with genital warts, TCA have been effectively used with no adverse effect to the unborn child. What about injectables such as your botulinum toxin or your soft tissue filler injections? There are no reported safety data on the use of botulinum toxin or soft tissue filler injections in pregnant women. Since most of them are cosmetic procedures and are non-essentials, I tell my patients to just wait until after they give birth to undergo these procedures. What about sclerotherapy, or removing your varicose veins? I don't do varicose veins in pregnant women for two reasons. Number one, varicose veins that develop during pregnancy have a high probability of spontaneous improvement. Therefore, it is best to wait 6 to 12 months after giving birth before you decide to have your varicose veins treated. And number two, what you inject in varicose veins can actually cross your placenta. That's why it's best to wait until after giving birth. And then finally, we go to laser and light therapy. Cosmetic use of laser has not been studied in pregnant women. However, certain lasers such as your CO2 or your Nd:YAG lasers have been effectively used in the treatment of genital warts in pregnant women na walang consequence to the unborn child. But laser and intense pulse light therapy for cosmetic or non-essential usage are highly discouraged when you're pregnant due to lack of safety data. For all the products, ingredients, and procedures that I recommended, that I said are safe or that you should avoid, my overall recommendation is that you still consult your dermatologist and your OBGYN because these doctors know your history, know you well, will be able to assess you properly and make the right recommendations. This is not the time in your life to experiment or to try things out. The good news is, a lot of these skin conditions typically resolve after giving birth. And if they don't resolve, marami naman tayong pwedeng gawin after giving birth that can improve all of the skin issues that you experience while you're pregnant. Once again, for any issue involving your hair, your skin, or your nails, don't forget and don't hesitate to consult a board-certified dermatologist near you. And if you feel that you learned something from this video, that you like it, and that you would want me to make more, please don't forget to click the subscribe and the like button. I would really like to hear from you. Please don't hesitate to put your comments, your suggestions in the comment section below.